stopwatch. I remember myself in school in those days. I can picture my schoolmates. You can picture the ones that are taking campus. And I look like that. The lead among them is there. And before that, he was on the streets. Simple. He didn't achieve anything. From school, he didn't go further. He ended up when he was back. He came here on the highway, and then he just did it. I'm giving you probabilities. I can also remember the ones that were studios. The point I'm making is that is a choice. And in this life, you don't need to experience everything to do what you learn. You learn from other people's experience. That's all. So it's a choice. All we're doing is giving you information for you to read them. How will you know somebody who is using drugs? That is, if you are close to the person, you find out that the person keeps a routine. Because then, once you know someone who is taking drugs, just keep the diary. You find out that there's a time when that individual would like to secure himself, either there or out, because he wants to take the drug at time. Within a span of 2 years. You have a friend, start watching him and the person secures himself. Take time and avoid it. You find out that it's time to go and take the drug. Because if he doesn't take the drugs, the withdrawal symptoms that I mentioned to you, which is a consequence of what the dentist will set in. And the withdrawal will get enough of it. So you know. So you know the routine that you do. 2. The person's dressing will change. Will start becoming small. If you're a group of friends and you are not taking drugs, the individual will start pulling away from your group. Because he doesn't want you to discover. That's number 1. 2, he doesn't want you to feel comfortable with that. The individual becomes unusually aggressive, irritable and aggressive. In somebody who used to be calm and normal. Once you notice that, you can't check. They are making you grow somewhere. Then you find out things will start missing. Because the drug habit is a costly habit. So if he doesn't have money, he has to steal to support the habit. So you notice that things will start missing everything. Or at home. When you see things like that, don't deny it, don't explain it away. Don't. You know my years as a psychiatrist, the most painful time for me is you sit down with parents, relations, and patients, and you're taking this. When it gets to draw this, you ask the patient, do you smoke or do you drink? Even before he or she opens his mouth to talk, the mother should start dying. No! He doesn't smoke, nothing secret. He doesn't do nothing. Then the patient will allow the mother to talk and lie. When the mother laughs, he says, "Doctor, I smoke with you. I don't listen to you." It's usually if you told them that they want to have fire, you see that they have aged more than 10 years. very, very common. How come? If you go to psychiatric hospital, yeah, if they bring in 100 youths and adolescents for a mentally related illness, into that, at least 40 to 50 of them will be from drugs. So you see, it's very common. Will be from drugs. It's very common. Very common. And that's why we're tapping and giving you this information to teach you to make the right choices in your life. Why would you take drugs? I'll come to that just get to the point. Why do you take drugs? There are many reasons you need to know. Number one is peer pressure. Why do you not take it? Because you are at an age, we call it impressionable age, where you like to do what you do. You know, I have a simple answer. Why should I be the one copying somebody? Why should somebody copy me instead of me? As you said. So something must be wrong with you. Why should you be the one copying? Why should you other people copy you? Why should they copy you? That's the question you should ask. So if you are in a group that is doing drugs, your best bet is wrong. Because that pressure is serious, it's real. It's real. Because this is the same pressure that takes innocent little kids into what? Cults. The same pressure. That's the pressure. So, like I said, life is a choice. You also have a choice to select the peer that you belong to. So if you are in a peer that is doing drugs, you are only saying it's only a matter of time and also joining them taking drugs. The only way is you want to get out of it. That's one. 2 is experimentation. I can remember the first time cigarette entered the home. You know, I was a small one. I don't know. What's the big one? What was the young man? May stay on the other. I was young when they finished and left. They should have cleared the table. I collected the balls and then the ashtray. The stops that were around there were in ashes. I said, let me taste this and this one. I just wanted to light everyone. Put it in my mouth. You know, I coughed before once it entered my hands, now you make prospects. I'm now I can see. I'm sure I have what was Broco's fast. I coughed and coughed. That was the thing. I never tried it. You get that? For most people, that is not out. But there is few people that will take it that first time. Nothing happened. You try it second time. Nothing happened. 10 times, 4 times before you do it. So, you see what experimenting your life over something like that is not working. So please, it's not those who do it. It's not working. The third reason, which for me is very, very important because we see this in clinical situation. If you have a problem in life, going on, please seek for help. There are people who are shy. It's not a crime to be shy. There are people who are afraid to speak in public. There are people who are afraid to eat in public. There are people who are even afraid to ask questions in class. In the other part of my life, I was asking questions in class. But to make sure I don't ask questions in class, I was a good boy. Bishop, I read so well that there was no need for me to come and ask for it. You get that? So one thing balances. But the point of it is that if you have a problem, seek talk to God, talk to God. There are people who have problems and they got the wrong advice and then started treating themselves. We call it self-advice. Then there's another one. Very important. Genesis. We are all wired differently. All wired differently. You can find somebody who takes 6 bottles of beer every day. Nothing happens. It's loud. And he's taking it for 20 years. You can find somebody who just started taking maybe 1 or 2 years and he's now serious something. So don't listen, because you don't know what the constitution is. But you can always know your constitution. You can't. You know, unless there is divine change in my genes, I know the way physically I'm going to end by looking at my dad and God. Simple. Look at your dad. Look at your mom. Have a neighbor. Every day she keeps complaining about me and everything. One day I know her. I said, your mom lived with you here for 20 years before she died. Can't you see that your physique and your mom's physique? And when you call your mom, right? She was complaining. I mean, you should be ready for this. Do you get the point I'm making? Because those ahead of you have lived a life that you are going to live, unless there is a divine intervention. That's all. I'm talking of physically. So you can ask again. If your parents didn't drink alcohol and you didn't have time to interview that as a kind of fight didn't drink alcohol, interviewing, you can tell me that the day you took alcohol, it was always for you. Why would you do that? Because you inherited your genes from your parents. You get it? So find out the things that they didn't comfortable with. The ones that are not comfortable with, they don't have to do. That way they can do it from. Because we're all wired different. So don't compare yourself with the next person because you don't know what is anything about this. Am I making sense? Yes. Finally, I said it before, your world is becoming more and more hostile. Your health is your choice. If you are lucky, there are people who are planning for you. In all likelihood, they are not. And I'll give you one example. They are saying, a couple of years, when I did my MBA, they told me I did everything we found out that the incidence of liver cancer was increasing in Lagos. When we compare the time, those 90s, when we were there, to the pre-independence, it was just increasing. And one of the things that causes liver cancer is a high concentration of copper in the water. And tell you the difference between those who take the form and our parents, rulers, non-leaders. Lagos is not cited in Lagos. Where is it cited? Iju. Iju was. We went and saw the documents. The colonial government found out that they saw inside Lagos proper has a high proper constitution. That is why they cited the word colonial laws in Iju. And we're talking about from Iju. These people who are there. But our only just came and they started citing Surulere name water works, Ijora name water works, Shogoro name water works, Bariga name water, and they were just saying one of you got called. And I said, you know, I don't think you Gamen. People live literally with waste bins now. They don't really see waste bins. You can't even take care of an item. You don't know what is going on. So in the midst of all this, don't can add more to the very challenges around you by making forward choices. I've given you all the components that make up the mental health. The job is for you to make the right choices from all these components that you give you. It is not your father's job. It is not your government's job. It may be their job to make the bigger policies. Then you, in your micro environment, you can determine what your life will be by determining that activities, the kind of company you do, the kind of things you drink, the things you are paying for. And if you do that, above all, from psychotropic drugs, your mental health is going to be very, very important. Once your mental health is going to be optimal, the world is coming. But if you make wrong choices, and your mental health is optimal, you will achieve your potential life. I am done.
Thank you very much.
My name is I learned all-time management in business stress, and that was how the name
My name is Kemi. Thank you, sir, for your wise words. But what struck me the most was the first thing you said, which
sure we also have questions. I'm sure there are one or two things that maybe you heard before and you need a bit of presentation or you heard for the first time at your read. So please, the floor is open for questions. Yes.
So you said heroin is the best painkiller. I said heroin is the best painkiller.
No, I didn't hear you.
Heroin, you said heroin is the best painkiller.
Yes.
Then why is morphine used more like in the army in more cases than heroin?
Why is morphine used?
More.
Okay. Because morphine is also as potent or even more potent. Actually, morphine is diacetyl heroin, okay? More potent than heroin. So both of them are potent. Morphine is still more potent than heroin. Okay?
Yes, John. Okay.
If you have anxiety and your doctor recommends Xanax to you, and after a while you stop taking it, and then you continue taking it again without his prescription, is that the drug abuse?
Yes. You see, when you have anxiety, anxiety is a symptom. That's what it presents. There is something under that is causing the anxiety. Okay? The ability is to find out what is causing the anxiety. And if the doctor spends some time with you and you are honest with the doctor, we'll find it. It could be time management as I mentioned. It could be an ensemble situation at home. I don't know. But to make sure your quality of life doesn't fall, I may decide to give you Xanax and Paracetamol. You get like to douse the panic, douse the anxiety while we are working on finding the root cause of anxiety. So it's a package. And my belief is that by the time I give you Xanax about 1 month, 2 months, 3 months, I should find out what the issue is. And gradually win you off Xanax. If I don't do that, then I'm not doing my best at you. And if you don't go through that treatment, you are not happy yourself. After that 3 months, or 6 months, or 2 months, and you continue, we are using Xanax. Have I made my point? Xanax is supposed to hold you, keep an even key, while we find out what the problem is. Once we find out the problem, you won't need Xanax. But like it or not, Xanax is also a dependence-producing drug. If you continue to take it, a point will come, you can't do without it. If you try to stop it, withdrawal symptoms will come, and you continue, and that is not well. Okay? Yes, sir.
Yes, Joyce.
Yes, that's it.
Okay, you can also write your questions down, and just in case we'll read them out.
Right. There are 2 ways actually. The humane way is admitting. There are drugs you can give individually and to quell the withdrawal symptoms and allow the drug to get out. The withdrawal symptoms, it has a physiological basis. You get that? You see, your body is the perfect factory that nature made. Every substance your body needs, your body makes. Let's take pain, for example. Your body has its natural pain killers. You get them? Your body has opiate receptors that some substances, kinases, act on. When you have pain, your opiate receptors come alive. Kinases act on them and the pain ceases. Now, if you go and take an exogenous, take morphine or heroin outside into your body, that morphine will go and act on. It's like the key and the lock. You get the argument? The morphine will go and insert itself and kill the pain. What does your body do? Once that opiate comes in, your body is very, very efficient. It will turn on its own manufacture of its own natural substitute. turn the factory off. Am I making any sense? It turns it off. Because you've sent in something, so it doesn't like to waste resources. So if you suddenly stop supplying the body with morphine or heroin, what happens? A vacuum is created. Because your natural substance is no more there. So that pain will become what? More excruciating. Am I making sense? So that's why you have the withdrawal symptoms. The pain will come in addition to other things. Diarrhea, nasal congestion, headache. Some may even have seizures, convulsion. So what we do is admit you. You get that? Place you on other substances that is not heroin. Allow your body to start manufacturing the natural substance. Once your body manufactures enough, the withdrawal symptoms will stop. And we can now start treating you for the dependence behavior itself. That's one way when we like to be with you. But if they don't want to be here with you, just get you. We call it cold talk. Get inside the room, come to the room and leave you there. And it works wonders. So you sweat the pain, everything. They'll just be monitoring you to make sure you don't die. By the time you go through it, it's not somebody that will tell you when you see drugs. But it doesn't still matter. When they see the drugs, they don't apply it. Let me tell you the classical experiment to tell you what heroin or cocaine does. Get 2 rats, stab them with food. Not stabbing them. No, stab them. But while you stab them with food, be giving one heroin or cocaine. Don't give the other one anything. And after 1 week or so, bring them out, give them food. Leave food, leave cocaine. The rat that you start food, that will go after food and be eating it. The rat that you give heroin will see food, leave food, and go after cocaine. And it will continue eating cocaine until it will convulse and die. Do you get the logic of that?
When people with disorders are prescribed drugs like Adderall or Oxy, how do people that prescribe the drugs with them treat them for meeting and
No, when people
are prescribed drugs like oxytocin or Xanax or Adderall, how do the doctors prevent them from getting addicted to the drugs?
how do the doctors do what?
Prevent them, because when they're taking drugs,
Yes.
how do they not get addicted?
It's tough. I hope I got your question very well. You know, it's tough in this environment where you can buy anything anywhere. You get it? Usually, when you prescribe a drug this way, certain period, 1 week, 2 weeks, 1 month. And after that, they're supposed to come for a review. And before you get the review, we review your condition. And decide whether I get the same dose or we increase the dose or decrease the dose. That's the idea. In most cases, in formal settings, that happens. You get it? But of course, there are a lot of people who fall through the cracks. That's one occasion when people complain that doctors don't tell patients their medicines. That's one of the reasons. You tell the patient the medicine, it comes once, twice, and disappears and goes and starts dying and continues. And you don't know what happens outside. And it has consequences. When I was a student, I will never forget it. Somebody came in, needed, we call it steroid, prednisolone, for a simple illness. You have what we call Bell's palsy. There's somebody, the infection that people can have. If you don't handle it well, it paralyzes a part of the face. But if you give this steroid, it stabilizes on the face. This person was given this medicine, and the face straightened. Because the face straightened, he didn't stop the medicine, he continued producing it. By the time he came back about 6 months or 1 year later, he came back actually because he had a fracture. Because that drug demineralizes the bone of the bone. By the time he came back, the bone was like paper, was recovered. You get it? So, any drug you take, remember that all drugs, anything that has an advantage has a corresponding disadvantage. It's a balance of cost and benefits. You get the argument? So that drug is meant to achieve a particular effect over a specified time. Don't carry it before that time without consulting the person who gave you that drug. You are doing it at your risk. I don't know whether I answered the question. So please, when you are prescribed medicine, follow it religiously. Don't carry beyond what you are given because you do not know the basis of that prescription. Always go back. Please.
You have a question?
So, as you were saying, I agree with you. At times are very more hostile. Wants to legalize cannabis and the things that has some benefits. Do you agree that cannabis has just totally detrimental?
Benefits relative to what? So that's the issue. Yes, that's the issue. We'll have to look at everything. You know, I just told you now. Anything that has advantage has a corresponding disadvantage. Yes, cannabis has some good effects, particularly vomiting in patients who are receiving chemotherapy. When people have cancer, there are many ways of treating cancer. You either do surgery, remove it if it has not spread. Once it has spread, you have to give them chemicals, chemotherapy to kill the cells directly. If you can't give chemicals, you give radiotherapy. Usually, when patients go through chemotherapy or radiotherapy, they have a lot of vomiting. You get that? Some also lose hair. So, the claim is that cannabis prevents that vomiting. That's why. There are many others. Okay? But the real issue is that before cannabis came on the scene, there were medicines that were already doing this. So it's not as if you are comparing it on a blank slate. So you don't compare cannabis with a blank slate. You have to compare cannabis with drugs that are also effective in brain cells. When you compare it, you find that cannabis does not have advantage over the drugs. That's why. That's the plus. Where do you factor in mental illness in cannabis? Is the proven of the fact there is higher incidence of mental illness, not just mental illness, severe mental illness, psychosis in people taking cannabis. How do you take care of that? You get that? So you have to balance that. I'm talking as a psychiatrist. The people who want to legalize it are talking because they want to make money. Yeah? Which one? That's it, but you also have to balance that economy with what is possible. There are plantations in California and Oklahoma waiting on banning the start shipping cannabis. And don't be surprised that you will not have conflicts against the cannabis. Go against the cannabis. You know? It's sad. It's sad because it's a big experiment. And we don't know where that experiment is going to lead us. The sad thing about it is that that experiment, by the time we see the effect of that experiment, we would have been late. The experiment that was done with LSD, with the hippies in the 60s. That's what we're doing now.
So you believe it's totally detrimental to human rights?
It is. I'm talking from experience. It is. It is. I don't see anything in this way. It is. And if nothing is done, they will succeed. And once they succeed, they are going to earn more than us. Because they are going to, granted that we are planting it here, they will refine it, package it very well, beautiful. And now people will go for the package.
Thank you for that. I have 2 questions here that I want to ask from the students. If someone wants to know exactly what psychedelic drugs are, and then what causes drugs to be addictive, and then particularly in the health of
Psychedelic drugs are the same category. They are another name for the hallucinogens. Okay? They are the same hallucinogens with psychedelic drugs. They are like drugs that disorganize you. They don't only stimulate you or depress you, they disorganize the system. they give you new experiences. I told you, you experience when there is no stimulus. Now, what makes them addictive? It's when you interview them, it's the feeling, the euphoria. You get the idea? I tell you, it makes me forget my problem. But it's only transient. When you wake up, your problem is still there waiting for you. But you must take it for what it is. Yes, it's addictive. It gives them euphoria. It makes them happy. I mean, people tell you that they are in the ninth heaven, they are in the seventh heaven. Because they go, they sit, they claim it expands their consciousness. Who wouldn't want his consciousness expanded? But the issue is that what do you see in that expanded consciousness? I don't think I'll finish the one that I have. I think people will be so why that is expanded. You get that? So it's real, but my argument is that, like I say, it is cost benefit. Look at the cost, look at the benefit. You know, so those are the things that make it addictive to them. The unique and unusual experience it gives them. But I would rather be grounded with the experience that I have than be floating with the experience that I don't know what the outcome will be down the line. In most cases, the outcome is not usually very, very good. And let me dispel one myth. You know, when they cite these examples, they go and cite examples of successful people who are using drugs. Some will cite fella, some will cite people. They are giving you the wrong picture. Take the whole picture totally. By the time fella was doing music in Albert Hall in London, he was not taking cannabis. If he was taking cannabis, he wouldn't have learnt the music, the jazz and whatever he plays, the sax. You get that? They didn't start when they were acquiring the skills. It was later. If you start when you have not acquired any skill, you will not go anywhere. Do you get my I mean, Michael Jackson, what killed Michael Jackson was Ketala. He was Ketala that killed Michael Jackson. That was no, not Ketala, I before. Which was good. But when Michael Jackson was learning music with his father, he wasn't on any drugs. You don't need any drugs to acquire the skills first. So when they cite these people for you, go back to their history. You'll find out that when they were young, they were not on drugs. If they were on drugs, they wouldn't have acquired the skills that made them world famous.
Good afternoon, sir. My name is Antonia. I have two questions. So my first question has to do with mental health. And I'm asking, like, Nigeria as a country is a very stressful environment for anybody to stay. But the case of mental health crisis in Nigeria is like, I don't want to say decreased, but it's not as high as other developed nations like the UK or the US. So my question is...
Case of mental illness?
Yes, like US or the UK. So my question is that, do you feel like if people become like more intelligent, more developed, does it like increase their chances of like mental health issues or crises? Because I think that your generation had lower rates of that than my generation. So that's my question.
Okay. That's your question?
Yes, please.
Now, okay, let me, the way to look at the question is the increase you are seeing, is it a real increase or an apparent increase? Just keep that in the back of your mind, okay? There are variations in mental illness across cultures. But even within these variations, there are things that are constant. Let's take the most severe form of mental illness, we call it schizophrenia. That one is constant across cultures. A lot of studies have been done over the world. It's hovers around 1%, 0.9, 1.1, 1.3, all over. Whether here, whether in UK or wherever. Incidence of schizophrenia is almost the same all over. You get that? But of course there are variations, depression and all of that. It varies from culture to culture. But I do not think that it's higher over there than here. What is happening? And that's why I think we are trying to lose the most important thing, safety net we have to contain mental illness. What is happening here is that our extended family system is still intact. You get the idea? Over there, you're your own. Over here, the extended family system is intact. Before mental illness comes to the public view, the family handles it. In the clinical setting here, it is rare to see a mentally ill person coming alone. Some people usually bring in, it's either a friend or a wife bringing a husband, or a husband bringing a wife, or children bringing their parents, or bringing bringing their children. But over there, it's not. If you are not alone, if you're alone, the best you get is a social worker will bring you. Get that? So our extended family system is still intact, and it is containing diabetes. Why is it containing it? There is no difference. The only difference between the mentally ill person that is naked on the street and the one that is receiving treatment, either Imagine or Ayana, is the one that is on the street has fallen out of care. The one that is Ayana or Imagine is still receiving care. The relations level. You get the idea? If you remove the relations, maximum 6 months, 1 year, that one that is living care will be on the streets. Because I told you, it knocks out the most important organ of the brain. Once you knock out the brain, the person doesn't know whether he's ill or not. He will remember to take his medicine. But if the family is still intact, they will remind him when he fails to take his medicine. Am I making any sense? That's one. Now, the difference between my time and your time is in my time, the level of poverty is not what it is now. In my time, people could still afford to take people to hospital and pay. Now, they don't. You see people, they'll come to hospital, pay the consultation fee, pay money for the first drugs, and go. You don't see them again until the person relapses because they don't have the money to pay. You get the point I'm making? So, the social fabric was still intact maybe 20, 30 years ago. Now it's becoming looser and looser, and the population level is increasing. And it makes it very, very difficult for people to want to be in care. And that is what you are seeing. So the increase you are seeing is apparent. It's not real. It was there. But we were not seeing it in the past because they were still taking care of them. Now they don't have the resources to take care of them. What you will not have seen in the past 20 or 30 years, you will now see because they are not taking their medicine. They are not following up with their appointment visits. And it's sad. That's what we find ourselves in. I don't know whether I've answered your question.
Yes, you answered my question. But for my second question.
Yes, what's the second one?
My second question is about the brain.
About
the brain.
Yes.
You said that we have three types of brain. So my question is like little children when they are born.
Yes.
Because like the only animal instincts like they are hungry, they want to drink water, they go on their body like just that. So that means that little children are born with their own brains. Yeah. So that means that like the brain that separates us like humans from like basic animals, like that brain hasn't started developing yet. So is it that it's like a natural thing, like just genetical that children grow up, like their human brain developing, or is it like as a product of socialization that it grows?
Both. What happens? You have one brain, but divided into 3 concentric parts. I told you the inner core, the middle one, and then this big one. Okay? This big one, by the time the child is born, both the inner core and the second core are fixed. It's this one that grows. This one grows when the child grows, keeps growing until around 3, 4. By the time the child is 3 or 4, the brain is growing. If you prevent that child from falling into danger, that child will survive without any intervention. You get my point? But as you are growing, then culture, civilization, rearing, socialization will be printed on this brain. I don't know whether I've answered the question. So it is still this brain, this one that I call civilization. So all it is that the little child that they are talking about, when he was a child, this one has not started functioning properly. So the one that is functioning is that the other one. And that's why we tell you, anything the child wants, he wants it now. I want to eat now. I want to drink now. I want to some rest now. He cries. Because this one is not working. Because if this one is working, he knows when to ask for food, when to ask for drink, because of this one.
Thank you, sir. I think we have time for just 2 or 3 more questions, and then call it over. I want to ask this connection that somebody sent this in. So she wants to know, you talked about the fact that maybe your genes, when you carry parents,
Yes.
you can know how you
Yes.
So she's asking, is that in all cases? What about cases where there are genetic mutation? Is it?
No, not in all cases, but in most cases. You get that? When you talk about mutation is good to learn it, but it's not so solid as it is in man. We have a few mutations, sickle cell and all that. But when you talk about genes, just look at your parents. I'm not surprised I'm wearing glasses. Because my mom was. My mom, as I'm talking to you now, is almost blind. I mean, she's seen they are going to do a cataract extraction. The only person I didn't see was my grandmother. My grandmother lived to one party. She didn't wear any glasses. My dad, my mom. So it will be a miracle for me not to wear. If I don't wear, that's good. You know, I'm not looking at it pessimistically. I'm saying it prepares you. In fact, it behoves you to make right choices to better what they have. But you should know where you are going. Because you inherited genes from them. And I'm looking at it in terms of the choices you make. What they didn't eat, particularly dangerous things, go and find out why they didn't eat it. If you are eating it, you are just using yourself for experiments. That's all. I don't know whether I've answered your question. You get the argument. But just look generally, look at your parents. The way they move is likely going to be, unless you make better choices than them.
Thank you. This one.
So I have 2 questions.
Yes.
Is it possible for someone to be born mad? And the second one is that if someone is born mad, is it possible to cure the person? And what causes them to be born mad? Do you understand?
I wish it's a very good question. But the problem I have now is the word mad, because mad is wide. If you mention a specific thing, then I can, because there are some, how will I describe it now? There are diseases in medicine we call inborn errors of metabolism. Don't mind the big word. Inborn errors of metabolism. I'll just give you a classic example. Do you know what amino acids are?
Yes.
Good. If you know about amino acids, you know the one that is called tryptophan. Okay, you just know about them. You don't know the individual amino acids. You know some of them. Yeah, tryptophan is one of them. Okay? Now, each of those amino acids, for you to use it in your body has enzymes that metabolizes them. You know about enzymes?
Yes.
Now, there are individuals that are born without the enzyme that metabolizes, that breaks up tryptophan. The name of the enzyme is straightforward, tryptophan hydroxylase. That's the name. They are born without that enzyme. So, if they take in tryptophan, what will happen? It will not be metabolized. It will accumulate in their body. And tryptophan, that amino acid is not good for the developing brain, both inside the womb and outside the womb. Before it was discovered, Children that are fed with diets that contain tryptophan, their brain will not develop, and they develop to become imbeciles. That's an answer to one of your own. Somebody was born an imbecile. Luckily, somebody discovered that it was tryptophan that was causing that problem. As far back as the 20s, once a child is born, they will screen to find whether the child has tryptophan aerogenes. If he doesn't have tryptophan, they make sure that that child is not given a diet that has tryptophan. So that child is denied tryptophan until the child turns 3, and you find that the brain will develop normally because it's not taking in tryptophan. Does it make any sense? That's treatment. Finding out what is causing it. Once you find it, if it falls within this category, you remove the agent that is causing the madness, and the child will be well. I'm just giving you one. That's the commonest madness that is inherited in children. There are many others. Okay? You've heard about Turner syndrome. You don't? You haven't heard? You've heard about Mongolism. So I can't go. At least you know children that are born and their eyes are slanted. Yes. And they don't develop very well. You get the argument? They seem stunted. That's Turner syndrome. That's Mongolism. You get the argument? That one is straightforward. We'll call it trisomy 21. You know, a human being has 24 chromosomes. Actually, 22 pairs of chromosomes plus the XY chromosome, the sex chromosome. Okay? The 21st chromosome is supposed to be what? 2. Each chromosome is always 2. There are people who come out with 3 of the 21 chromosomes. We call them trisomy means 3. Trisomy, that's what that's in. Usually most of them are born as imbeciles because of that. There's nothing anybody can do about that. It's ingrained. I've given you one that you can do something about. I've given you one but there's nothing you can do about it. And there are many born errors of metabolism. I just pick one for you. If I start going into the ones, you won't understand. I don't know whether I've answered your question.
Okay, someone sent in a question asking about schizophrenia. Says he thought maybe it has something to do with genetics. Schizophrenia.
Okay.
So because it has something to do with genetics. So how come is this common? And then also, can schizophrenic people live normally?
All right. The straight answer is that schizophrenia is not one disease. There are categories of schizophrenia. You get the argument? So once you have that at the back of your mind, there are categories of schizophrenia. For example, let me give you one. If you make the mistake of taking the stimulant, amphetamine, the one I call fire, those who take amphetamine develop a schizophrenia, a psychosis that is similar to schizophrenia. A schizophrenia-like psychosis. You get the idea? So a drug can cause that. Okay? Yes, there are schizophrenias that are genetic, heavily loaded. But the bulk of them are not genetic. I don't know what I've answered the question. The bulk of schizophrenias are not genetic. But there is a core schizophrenia that is genetic, and you find it runs in a family. You may miss a generation, but it runs in families. When I mean miss a generation, a prototypical genetic disorder is sickle cell disorder. ASS. If you have SS and you marry SS, there is no, unless there's intervention, there's no it transmits through. There is schizophrenia. You can have a schizophrenic man, marry a schizophrenic woman, and they have children, and the children will not have schizophrenia. They will develop normally. Then their grandchildren will have schizophrenia. You get the argument? So you can skip the generation. So there are schizophrenias that are genetic, but the bulk of them are not genetic. You get the argument? But like I told you, a lot of studies solve it. economic eventually can be done all over the world, including Nigeria. The prevalence of schizophrenia across cultures is approximately 1%. In some places about 0.9, 0.8, 0.9, in some places 1.1, 1.2. So that one has been established. But I agree with you, there are some heredity. Just have at the back of your mind that schizophrenia is not one illness. Just like hypertension is not one illness. Just like heart failure is not one illness. Because various things can cause the illness. Yeah, so you must know what is causing which before you can, break the knot. That's the answer I give you. Yes. Can they be normal? Yes, they can. They can. There are many schizophrenics that are living normally. In fact, they are living hypernormally. They are living hypernormally. Actually, most of the benefits that you and I are enjoying have been produced by the so-called man. You know the incidence or prevalence of mental illness. You heard about Silicon Valley?
Yes.
Yes. The prevalence of mental illness in Silicon Valley is close to about 3 times that of the general population. Most of the guys who are writing all this software that you are talking about, most of them are not in the head. They just concentrate on computers.
Okay, I also want to say one I think this one concept, I think it's particular to it says the students are unable to sleep. He has been trying for a while, has been lying down for a long time. He just an hour and what is the cause and how can it be helped to manage
Sleep. Alright? That's 1 hour. For how long? For how many days? It's not a sleep problem, or you try to sleep for maybe a week or two and you don't succeed. You get the argument? If it's just a